Welcome to Distrust and Disparities, Dismantling Black Health Disparities podcast. We examine health disparities that disproportionately affect Black women and Black families. In addition, we amplify organizations and individuals working to dismantle racist health practices and systems to improve health outcomes for marginalized communities. I'm your host, Jasmine Moore, a registered nurse, and I'm joined by my good friend and co-host, Camille White.
We discuss drug use, addiction, overdose deaths, and other triggering topics in this episode. Listener discretion is advised.
Their reporting found that overdoses began spiking in Baltimore about a decade ago, as fentanyl ravaged the city grappling with multiple challenges, including gun violence and later the pandemic. They also found that one demographic has been hit especially hard: older Black men, who make up just 7% of the city's population, but account for nearly a third of all overdoses.
In this episode, we discuss the opioid overdose crisis in Baltimore City, which has claimed nearly 6,000 lives in the past 6 years. And we highlight Be More Power, peers offering wellness, education, and resources, a harm reduction organization focused on saving lives, meeting people where they are, and embracing any positive change, no matter how small.
Welcome back to another episode of Distrust and Disparities. We're happy to be back and recording and, here with another episode and another topic that hasn't been talked about too much, but needs we want to bring more awareness and more attention to this crisis that is going on. So, crisis among crises. That's the term.
Yes, it is. It's, there's multiple crises happening constantly, and there's like, oh, there's this one, and then there's this one, and we got to talk about this one, and then there's this one.
Right.
And I feel like that's how also this became something we can talk about in the articles and stuff and all the statistics, because there were other crises happening that then overshadowed this crisis that has always been an issue, but then priorities got shifted and changed, and people unfortunately fell through the cracks because we were worried about other stuff.
Yeah, and it ain't even a crack. It's like what's larger than a crack?
Like a crater.
Crater, yes.
A sinkhole.
Yes, basically. That's what happened. But let's jump into this week's episode. So, more than 100,000 Americans are dying from drug overdoses every year. And it's largely due to the synthetic opioid fentanyl. But in recent years, no city has been hit as hard as Baltimore, Maryland, when it comes to overdose deaths. In 6 years, from 2018 to 2022, nearly 6,000 lives have been lost. And that is almost double that of any large city. And it's higher than nearly all of Appalachia during the prescription pill crisis, and the Midwest during the height of rural meth labs, and New York during the crack epidemic. And you may be thinking, how does this drastic increase in overdose deaths in a major city go undetected? And this is what this week's episode is going to focus on. We want to discuss the eye-opening investigation by the Baltimore Banner and the New York Times about Baltimore's drastic increase in overdose deaths. They conducted a thorough investigation of Baltimore's response to overdoses. They reviewed thousands of pages of government documents and interviewed more than 100 health officials, treatment providers, and people who have been addicted to drugs. With all this information, records, and interviews, they revealed the extent to which the city's leaders failed to properly address the enormity of this overdose crisis. And additionally, I want to highlight some disparities, because even when it comes to overdose deaths, like we always talk about, some of the poorest and marginalized communities are often affected even more. Johns Hopkins University, their 21st Century Cities initiatives, their findings show that the poorest and least educated are the most affected by fatal overdoses. And their findings show that 4 out of 10 people with an annual household income under 30,000 have lost loved ones to drug overdoses. Those same households are more than 5 times as likely to know multiple people addicted to drugs than are households that earn over 110,000 annually. Respondents without a high school diploma are nearly 4 times more likely to have had someone close die of an overdose than are respondents with a master's or doctoral degree. They were also 6 times more likely to know multiple people addicted to drugs. And the percentage of Black and white residents with similar socioeconomic statuses were roughly the same, like the amount of overdose victims, but white residents are less likely than Black residents to report knowing multiple people struggling with addiction, according to the researchers. So I just wanted to pull out those statistics. It just shows like people a part of marginalized communities with who are economically disadvantaged, it seems like they're turning to substances, illegal substances, and they're dying at a higher rate. So it just goes to show like we need economic opportunities in certain communities, and maybe this will help to lower the drug use rates and the overdose rates. So I just wanted to plug in those statistics.
Have you checked out our website? There you can find all of our episodes and show notes. You can even listen directly on the site and catch up on any previous episode you may have missed. You can read our bios and see what we're up to. Also, we made it even easier to contact us. Just fill out the form on our homepage and click submit. We invite you to recommend guests and topics we should feature. So what are you waiting for? Go check us out at distrustanddisparities.com.
All right, let's hop into the main story for this week. Like I said, we want to discuss this article from the Baltimore Banner and the New York Times. I just want to read this quote from the article. I'm just going to read it directly. For nearly all of the past 3 decades, Baltimore has had one of the highest fatal overdose rates of any large U.S. city. But for most of that period, even as the HBO series The Wire helped cement the city's reputation as the U.S. heroin capital, the death rate was much closer to the national average than it is today. Officials have long tried to solve the city's drug problem with arrests and aggressive policing. Baltimore was also at the forefront of innovative public health strategies to address addiction. In 1994, the city's health department was among the first in the nation to start a legal syringe exchange to stop the spread of HIV and other bloodborne illnesses. Beginning in 2006, the city and the state spent millions to expand access to buprenorphine, one of the most effective opioid addiction treatments. Fatal overdoses dropped, and Baltimore seemed to get a handle on its heroin problem. So let's talk about, what happened after, we got control of the heroin problem. Like I said, the city was very aggressive with its drug use and prevention and, doing, cutting edge public health initiatives. And I was reading this book, When Crack Was King, and it had the author interviewed Kirk Smoke, the mayor of Baltimore, when, heroin and the crack epidemic was at an all-time high. And Baltimore was kind of at the forefront, or wanted to be, but politics, just figuring out how to tackle like the heroin epidemic and crack in the community. And they were looking at even like legalization and trying to take the focus from criminalization. Like the big push was lock people up, put people in jails, but Baltimore was really trying to focus on, this is a public health crisis, like back in the 2000s. So now when we come full circle, like 2024, where we're talking about, addiction and mental health being a public health crisis, and we want to address it. So I just wanted to pull that up, even though this article that came out is just talking how we just dropped the ball. We were doing so good, but we dropped the ball. But we should have hope. We can pick the ball up and get to work. Save our city. Save our city. Yes. Because if you don't know, both me and Camille, born and raised in Baltimore, Maryland.
Yes.
Even though I'm working in the Bronx, I feel like it's like Baltimore steroids, or it's a whole new game. I just want to plug that. We gotta save our city always.
Yes.
So in 2010, the city's overdose death rate was at a 20-year low. There was 29 deaths in the city for every 100,000 residents. So low. We were on top of it. 5 years later, in 2015, the rate had doubled. And then it doubled again 3 years later. So by 2021, it was up to 190 deaths per 100,000 residents. And that looks like an average of 3 people were dying every day. And think about where we are in 2021. This is like the height of the pandemic. And you have people, like large amounts of people dying of an overdose. And during this time, this is when the synthetic opioid fentanyl, which is so potent, even just small, tiny amounts can be deadly. This is when it became very prevalent in the market. When fentanyl was first coming on the market, Baltimore's initial response was hailed as a national model. The city set ambitious goals. They distributed Narcan widely, and Narcan is opioid reversal. So if somebody overdoses and you see they're like unresponsive, you can give them Narcan, the medication, through their nose, and this will help to reverse the opioids in their system. And it works really quickly. So Baltimore was distributing Narcan to people, and they were also trying to steer people into treatment and also alerting the public to what was going on. In 2014, alarmed by the rising overdose deaths, Mayor Stephanie Rawlins Blake created a task force to address it. The city's health commissioner, Dr. Lena Wen, she widely distributed Narcan even before it was available without a prescription. And the health department trained police officers and the public on how to use it. So everyday people, first responders, police, they can give Narcan. So this is like, very aggressively targeting overdose and being able to recognize it. The department also opened a crisis stabilization center, a place to find help after an overdose. So helping people after they overdose, because if we don't catch an overdose in time, you can die. It can lead to, a death. And just imagine you passed out almost on your deathbed and then somebody saves you with Narcan, just being able to recognize, get the help that you need so you're not in that predicament again. This would be a good time to segue you into treatment. Like, you was about to meet your maker. Like, we need to start scaling back. This might be the time to really get serious about getting clean. So they opened up this crisis stabilization center. Additionally, the city also created an alert system to send aid groups to overdose clusters, like areas where there was like a high rate of overdose. And they piloted a real-time capacity tracker to help patients and doctors find open treatment slots. So to get kind of plug people into treatment centers. And on the public awareness, one of the campaigns to bring more public awareness to what was going on, they put on billboards and bus stops this website called don'tdie.org. And it was designed to, quote, knock people over the head about the risk of fatal overdoses. So they were being very blunt in your face about what was going on in addressing this crisis. And this is like in 2014. Let me plug in a little personal note. So around 2014, I was a fresh baby nurse working in University of Maryland, a major hospital in Baltimore. And I do remember like getting trained on like Narcan, how to use it and how to treat people. Is very common, Narcan. And I used to I still do keep like some Narcan in the car just in case, like you never know. And even just like walking, like where I work in like Harlem, just to have it on. And even at my program, we had people come and they trained our participants on how to use Narcan. So it was like very readily available. Like even when people brought in like people to the emergency department, like police, they was like, yeah, we gave him Narcan, here you go. Now he mad because he's not high no more, but he's alive. So I just wanted to plug in that little side note. So it was like really in your face, like overdoses and things like that.
Yeah. So the city was like doing all of this, but unfortunately, overdose deaths continued to accelerate. And then we had the next mayor come in, Catherine Pugh. And she ended up drawing criticism because she objected to the proliferation of treatment centers within neighborhoods, saying that people needing help for addiction would have a better chance if they were removed from Baltimore's drug-afflicted communities and, quote, put on a plane to Timbuktu or somewhere, which is... I mean, I don't know if y'all know Catherine Pugh. If you like from Baltimore, you know Healthy Holly scandal, and she got all these charges and like I think convicted, right? I think that's what happened. And then like she disappeared, got pneumonia, and we never heard from her again. Like she left the office in disgrace. And it's one of those things where I don't know how you are trying to be a leader of anything, a leader of a city that has a bunch of different issues, and like that's how you want to respond. It's just remove them. I don't want to see them. I don't want to deal with them. That's not how you deal with something that's going to continue to happen.
Right. When it's like 1 in 4 people are addicted to substances or something like that, crazy statistics, and you just want to remove them from the neighborhood.
Yeah, it's just like, let's just like make them go away and like the problem solved. Like that's the dumbest thing ever, and that does not work. And then with that, so you have Catherine Pugh saying that as the mayor, and then Dr. Nguyen ended up leaving the Baltimore Health Department agency in October 2018. And like I said, Catherine Pugh ended up resigning the next year, so 2019, because of the corruption scandal. The second mayor, unfortunately, criminally charged in a decade, which is just like, y'all not helping. Like, no. Y'all get into power, and then it's like, y'all got all these issues and baggage that y'all bring in, and it's just like, this is not what this city needs. We can be hopeful. We can have a better future, but we need the people who are leading it and elected to lead it not being criminals. Is that too much to ask?
Right. Is it?
Is that?
Is it?
Is that?
Is it? Mm.
So in November 2020, Brandon Scott was elected as the interim mayor and had been in place for a year while the COVID pandemic was in full force. So that was November 2020. And Baltimore also had one of the country's highest homicide rates. And Brandon Scott's administration prioritized reducing shootings. When homicides fell by 20% last year amid a national decrease, Scott credited his administration's efforts, which I can understand given our homicide rates were high. It was like a shooting a day. So I get where, again, your priority shifts. Things, you want to focus more on other things when it's just like things are a big deal. And that's the problem when like you have crises upon crises. And if you don't have the resources to evenly give all the effort necessary to address them all appropriately, something's going to suffer. Something's going to fall through, as you said, not just a crack, but like a sinkhole.
Right. So you got people shooting each other, people doing drugs, and then this is at the height of a pandemic.
Yeah, it was just like, what else could go wrong? Literally.
Right. Like the perfect storm.
Yeah. And we have to point out that while there were 3 times as many drug deaths as homicides, some of the overdose initiatives began to fade away during those tumultuous years. And again, I think for a lot of people, maybe it's like the deaths are always going to be acknowledged on the news. I feel like slowly but surely media coverage was focusing on homicide rates and not overdose rates. So like what happened and why did so many of these efforts come to a standstill? The sharp increase in deaths came as the city faced numerous challenges, as we've even talked about, but additional ones were a shrinking population, tensions, of course, over policing following the death of Freddie Gray, a lot of turnover of people at City Hall, as well as we mentioned rising shootings, but especially among young people, and COVID-19. But as Jasmine put on the outline, like besides COVID, are any of these problems new to the city? Which, yeah, realistically, no. Like everybody leaving City Hall because I feel like in a lot of places, like government, local, state, federal, like there's always issues and people get burnt out and you don't want to work there anymore. The shootings among young people are like, what opportunities, what are going on with them in the community for them to not get involved in activities and be in spaces where gun violence is sort of the norm, unfortunately. And yeah, people were pissed about Freddie Gray, rightfully so, rightfully, like what happened to him was awful. And then you have people not feeling safe or feeling like there are opportunities in the city, they're leaving. It's like, why we want to stay here? This is not good for me. This is not good for my family. So like all of these things were happening.
Just looking back in like retrospective during the height of the pandemic, like news coverage was focused on the pandemic, how to stay safe. This is like major. This is global. People are locked down. So new things are going on. Also funding from the government was going to COVID and the pandemic. So that's probably the shift. All resources on deck probably shifted to COVID. And then this was also when we had Trump. So we have a pandemic. Trump is on the news. I just know, just thinking back, I know it was like a hot mess. I was working like crazy, but that's where the focus, that's where everything went to.
And during this time, the city's overdose death rates far exceeded that of any other large U.S. city. But the problem went unnoticed, and there was a lack of urgency to do anything about it. And Baltimore City Council members rarely addressed or inquired about the growing number of overdoses. The fact that the city's status became so much worse than any other of its size was not known to the mayor, the deputy mayor, who had been the health commissioner during some of those years, or multiple council members until they were recently shown data compiled by the New York Times and the Baltimore Banner reporters in 2024. Jeez. And mind-boggling that, like, I'm sorry, what? the people in charge who should know, who should have been known, someone whose literal job was health commissioner, how is that still not on your mind going, let me be checking on the drug crisis? How is that still not, wouldn't that be a part of your skill set and experience you would be bringing to the table as the deputy mayor to make sure that ball isn't dropped, to make sure that's being paying attention to? So the task force managing the crisis once met monthly, but convened only twice in 2022 and then 3 times in 2023. So y'all went from every month meeting, discussing what are we doing, the initiatives, what are the statistics, how are things working out, what do we need to, step up on? And then you go in 2 years down to 5 times you meet in 2 years.
Yeah, that's crazy. Like we said, as the pandemic is starting, the overdose rate was already at an alarming rate. So what you thought people were just going to stop doing drugs during the pandemic? Yeah. And it seems like they just probably lumped all those deaths, just people are dying, just blaming it on COVID, with you're not meeting and really checking to see what was going on. Yeah, it's just ridiculous.
It is. And it's one of those things where I think people already in certain spaces working with different groups of people, like other people were able to recognize, there's going to be an increase in, domestic violence cases, that now people are stuck, forced to be home all the time with their abusers. There should have been alarms ringing in people's minds who worked with addiction, who worked in treatment facilities, going, yeah, people going to start using drugs more. We're in unprecedented times with this virus running around killing people. So of course, yeah, how like they're just self-medicating at that point. It's like the world is on fire, so let me get high and not be a part of this right now. Like, I understand it. I completely understand it. Yeah. So by then, fewer people were being revived by emergency workers. Fewer people were getting medication to curb their opioid addiction through Medicaid, and fewer people were in publicly funded treatment programs. What also contributed to the lack of knowledge of how bad the problem was the fact that Baltimore health officials began publicly sharing less data, which reminds me of like when it came out how like nursing homes with COVID were like being very hush hush and not reporting their numbers, because all of a sudden you're more worried about your image, and instead of going, hey, yeah, we know these numbers are terrible, we know what's happening is terrible, we need to tell everybody and their mama so we can get the help we need to address this. Instead, you're more worried about saving face and going, well, we'll just share less because it's so bad. It's like you can't keep the bad news to yourself and hope that you can magically fix it on your own. You need to make everyone aware so the right people can get involved to try and make things better. Because typically state and city agencies, they always track deaths and then they report the overall count to the U.S. Centers for Disease Control and Prevention. But Maryland and Baltimore officials, often citing medical privacy concerns, have not published more detailed info on overdoses that is readily available like everywhere else. And of course, that secrecy has hindered awareness of the epidemic and responses to it. And this is coming from former city employees and community workers. Like they're sort of, ringing the alarm after the fact to be like, yeah, I was in it. I was working in these places and like we were being secretive about it. And like, look where that has gotten us, unfortunately. And what's even crazier was in the article was that the state's office of the chief medical examiner refused to provide full autopsy reports until the banner won a lawsuit compelling the agency to disclose the information, which identified who died, where they died, and how they died. So you had thousands of deaths were invisible to the public and government officials. And if this information was readily available, you would be alarmed. Like, it was like off the charts, and it's just like,
right.
You had to be sued to release the truth.
Right. But I'm just thinking, like, if we're so focused on homicides and shootings, they are providing that information because that's the focus. That was like the priority. But people are dying because of other reasons. Like I said, the overdose rate was 3 times as high as the homicide rate. But is it this stigma like, oh, it's just an overdose, how these people died? It doesn't matter, but we're so focused on people shooting each other. But people are also dying because of substances. They're overdosing on that. Like, why aren't we sharing these? What are the other issues? It could be other disparities that we are missing because we don't have this information. It just so happened that we're investigating overdoses. But what else are people dying of? What else is going on that we can possibly fix and intervene? And it's crazy that it has to go to having like a lawsuit come out before we want to address it. And once we got those numbers, if you look at where Baltimore is compared to other cities of same sizes, other major cities, we're like off the charts. It's like if you're looking at a graph, it is just through the roof. Like the national level is here, and then Baltimore is way up high with over, like we said, over like 160 deaths. And the national average is like floating like under like 40. And Councilman Mark Conway, who leads the city's public safety committee, he described the deaths as completely unacceptable. And he would have called for more hearings if he had known how much Baltimore was an outlier. And Dr. Laura Scott, who was Maryland's health secretary since 2023, she said the numbers are horrifying. We haven't deployed the right resources in the right places. Additionally, many residents say that they don't see the government doing enough. And they point out that the city needs to be more proactive in aiding people with addiction. And a quote from Reverend Derek Dwight, whose church hosts recovery support group meetings in West Baltimore, he's quoted as saying, "These are not people who say, 'I need help,' and go on the bus to get it," he said. "You got to bring it to them. You got to hold their hand. The addiction has done so many things. Overdose is the final step." Like we talked about in the beginning, like those campaigns actively in the community, handing out Narcan, making people aware of their resources. Like you really got to be on top of this. And I'm just going to talk about, the mayor's response. So the current mayor, who is the current mayor now, and back in 2022 or 2020, Brandon Scott, he says, "We have done a great job of trying to focus on multiple epidemics at the same time." Quote.
You're like, he said that. I ain't say that. He
Right.
said that.
He said great.
I wouldn't say great, honey. Like,
Right.
have you seen how many people have died?
And he said in another interview, he acknowledged that Baltimore has, struggled with a severe drug addiction and overdose for decades. And he says the analysis may provide better understanding of its scale, but it will not change his administration's approach to how they're handling things. And the mayor's office said that the current fentanyl crisis had been triggered by the influx of pills from drug makers and distributors. And he also said that this article by the Times and the Baltimore Banner, their reporting on the city's response amounted to misguided victim blaming. So basically he's saying they're just trying to compile all this information to make the city look bad. But I'm like, if we were looking at this data and looking at these charts, we wouldn't need this huge article, and, we would be on top of it. Like, it wasn't until this article came out that y'all wanted to do something about this.
Yeah. And that whole quote, like misguided victim blaming, they're not blaming the people who died of overdose for their own deaths. They're blaming the city in which they reside in for not responding to the crisis and acknowledging it. Like, I'm sorry, honey, but we had to sue to get the statistics. Do not try to act like the city government is a victim in all of this. Y'all are not. Y'all are not.
Y'all were okay with not knowing how people were dying and getting the complete picture. And the article, their investigation, it pointed out that the prescription pill epidemic was far less severe in Baltimore than elsewhere in the country. Baltimore received a fifth as many pills per capita as some areas, and this is according to the Drug Enforcement Administration. And oxycodone was the cause of relatively few deaths in the city, according to the CDC and state data. The death rate remained relatively low until the mid-2010s, and that's when fentanyl flooded the illegal drug markets across the country. So Brandon Scott, he's kind of saying like everything is because of the opioid crisis, but it's not. But this could be in part because back in 2018, the city had done multiple lawsuits against pharmaceutical companies for the over prescribing of opioids and prescription opioids. And Brandon Scott and Baltimore City, his administration, they opted out of the $400 million settlement that the rest of Maryland agreed to. And it carried on with its lawsuit alone, gambling for a larger payout. And good news for the city that they did win some major lawsuits. So as of right now, the city's total recoveries for opioid settlements come to approximately about $400 million. And Walgreens will pay $45 million by the end of this year, and then they'll pay the remainder in December 2025. CVS and Allergen, they settled for $45 million. Cardinal Health for $150 million, and Teva for $80 million. So this is a major for the city winning these lawsuits. And Baltimore leaders, they have said that the city would be using the entirety of the settlement for opioid remediation. And Brandon Scott, he signed an executive order establishing the Baltimore City Opioid Restitution Fund. And they also created 2 new city positions to oversee the use of the settlement money, establish a community advisory board, and required the city to publish an overdose reduction strategy. So what was the total amount? About $400 million. So this is a lot of money, and it really needs to go to addressing this overdose problem, getting people into treatment programs, preventing people from doing drugs. And this could also look at creating economic opportunities, you know, maybe even thinking about what you're going to do for the kids. Like, you know, they need to come up with a major plan. And I just hope we don't drop the ball. If we're doing this podcast, 5 years from now, I don't want to open up another investigative story like city scandal, money not used for something. I really hope they do something.
I feel you, because that, unfortunately, I don't want to be all pessimistic and immediately go to like, oh, what can go wrong? But like, governments are known to do that. They get these large sums of money and then they just start handing it out. And they start giving contracts to like friends of friends and people who should like never have it in the first place, where it's like, you first need to be looking at organizations that are already in the community, already doing the work. You need to be going to treatment centers that already have connections with the people you're claiming you're trying to help, and start there. Don't just
Exactly.
all of a sudden have somebody, especially, people coming from out of town, out of state going, oh, I can come in. If you give me 20 million, I could do this, that, or the other. No, 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 no. There need to be so many more checks and balances when it comes to creating these contracts that are sometimes multi-year and all these agreements, and this money is just handed over to people. And then there's like nothing to show for it a lot of times, because that has happened not only in Baltimore, but a lot of other places, unfortunately. And it makes it where people don't trust the government. People don't believe in you because you're over here talking about we've responded in a great way. But it's just like, I know of another story that, like, I wouldn't say is like connected to this, but you gave money to somebody from New Jersey to build up West Baltimore, and they spent decades just stealing and scamming because ain't nothing built up, honey. Like, so let's be real and like, let's acknowledge where like you haven't done great. No one really has. I don't, what, you want to give yourself an A for effort? No, we're not doing that. You need to try better. You need to do better. And like, let's make sure this money goes to people who actually need it, and it needs to start with organizations that are already in the community. They're there. You need to make connections. You need to talk to them. You need to reach out to them and go, hey, how much do you need? What are you going to use it for? Okay, here you go. Let's start implementing this stuff. Let's start saving lives.
Right. What is working? Who has the connections? Who's already in the areas that are most affected? Let's start targeting the people that really need the resources, because they're already probably doing a lot with the little that they have. So if we bump the amount of funding that they receive, make sure they don't have to jump through, like you said, extreme loopholes. We still want to have checks and balances, but supporting people that are doing the work already here. Yeah, because like you said, people sniff a little bit of money, and then all of a sudden, like, oh, we do drug treatment, we do this. Like, no, let's really vet people out.
If you are enjoying this episode, you should consider buying us a coffee. Yes, a coffee. That small gesture will help us continue to create quality episodes and content. Click the Buy Me a Coffee link in the show notes, or check out our website at distrustanddisparities.com.
Speaking of organizations, we'll kind of segue into our segment where we feature an organization really working to address the problem, address overdose. And in the article that we discussed by the Baltimore Banner and New York Times, it highlighted the death of Mr. William Miller. And Mr. Miller, he was 65 years old, and he was one of the founders of Be More Power. He dedicated his life to building Baltimore's peer-led harm reduction movement. He was an inspiring community organizer and an advocate who was dedicated to fighting systems of oppression and working towards liberation. Unfortunately, in 2020, he was discovered in his bathroom, and this was like one day before the birth of his grandson, and they found a single empty gel capsule, commonly used to package powdered drugs, in his trash can. And he had been shot, and he survived HIV, hepatitis C, and decades of overdoses before becoming a community activist and founding this program, Be More Power. And his son said he was concealing his relapse so that others wouldn't be discouraged, and that unfortunately cost him his life. But Mr. Miller's legacy and dedication to fighting for the dignity and rights of people who use drugs still lives on with the Be More Power organization. So we just want to give you some information about Be More Power. Be More Power was established as an independent team of outreach workers in 2017, and they joined the Behavioral Health Services Baltimore. This is like a big resource for addiction in 2020. And the team is fully staffed by people with lived experiences of using drugs. Be More Power works throughout the city, fulfilling the team's mission of saving lives, reducing harm, and working to mitigate risks that increases cases of hepatitis C and HIV/AIDS. Be More Power is a critical arm of Baltimore's behavioral health services team, and they work to respond to the city's overdose crisis. So, the organization's mission is to help people safeguard themselves and communities from mental, physical, and societal harm. They're there to save lives, like we said, reduce harm, and address risky behaviors. And they offer non-judgmental support and information to the community that they love. Like I said, these are people who have experiences with using drugs, and they're going out into their community. They're talking to people in their community, getting them help, getting them connected to the resources. And some of the activities that they do include distributing Narcan, also fentanyl test strips, providing condoms and safe sex supplies, giving overdose prevention and education, hygiene kits, and wound care, and also connecting people to other behavioral health services. So they're like the basically on the ground street team, helping to reduce harm, meeting people where they are. So, like I said, educating people on how to use Narcan, there's test strips where people can test their substances to see if it has fentanyl in it, and providing, how to prevent overdose and connecting them to resources. And I did when I was in college, I did a harm reduction internship, and I worked with like Baltimore Needle Exchange, and people really connect with the peer workers. They're able to meet them where they are and really relate to what they're going through. And more people go through harm reduction programs to get help. Like when they finally kind of hit rock bottom, this is like a safe, non-judgmental space for them to come to get help. So when they're ready for it, they're there to get them connected to the services. And then they're also there to help them if they are addicted to drugs, to make sure that they're doing it safely and things like that. So really meet people where they are. And you can check out the link to the website in our show notes. And they have a calendar of places that they go to for weekly outreach. And this kind of correlates to where like the most doses take place. So you can check out their calendar. And you can also, if you say you run a mental health program or any type of treatment team, you can have them come out to a local event to educate people on how to use Narcan and just like what is going on. So definitely check out their website in our show notes.
Thanks for listening to this week's episode. Do you have recommendations for topics we should discuss about health disparities or injustices? Guests we should interview doing amazing health justice work? Or organizations we should highlight creating positive change for marginalized communities? Please visit us at distrustanddisparities.com or email us at distrustanddisparities@gmail.com. Remember to subscribe, rate, and review us wherever you listen to podcasts. And follow us on Instagram, Facebook, Twitter, YouTube, and LinkedIn.